And would you mind if I give you my email? Because I'm doing a poster for Nurse Week.
Yeah.
Can you send me your stuff?
Of course.
I'd like to include it.
Yeah, no problem. I can definitely do that. I have it all on the computer anyways.
What kind of project are you doing?
Who, me? Yeah. Pretty much our interventions to the pathway.
For the Nurses Week or whatever?
Mm-hmm.
You have to present it?
Mm-hmm. At my little table and stuff.
Okay. So this is like a handout for you guys. You can read along as you would like. It doesn't have all the information, but it has some of it. So, as you guys know,
I told Linda to come.
No, please. And if you guys have any questions at any point, you can we don't have to wait till the end.
All right, is it on?
Throw them at me. Yeah, but I can edit this part out. Okay, and then they have a handout over there of different stuff I'm gonna go over. So
fancy.
I know. Thank you. I mean, I put hours into this. I put major work. But okay, so I did my project on the Pathway program. It kind of started out being just about the visitor policy, but as I was really talking to everyone and spending more time on the unit, I realized that you guys have confusion with kind of the program as a whole. So I wanted to propose changes to the program as a whole. So I named my project "Clear the Path." I thought it was cute. But you guys are very familiar with the Pathway program. You deal with it every day. You guys do a great job. But I wanted to just kind of go over it. So the Pathway program started implementation in July of last year. It's for IV drug users who will be here for 6 to 8 weeks, and they don't have the access to the substances. So we want to give them a way to recover. They're already going to be here. We're in an opioid crisis. It's a good way to tackle it. So I observed the problem by just being on the unit, talking with you guys, talking with patients. Everything all together really showed me that this program is needed, but it is still in the beginning stages and still has a long way to go. This is important to this facility because this is the only, in all my research and in talking to Tammy, I don't know of anything quite like this. I couldn't find anything quite like this. So this is very specific to your unit, and it's very important to your unit, but it's important to nursing as a whole because the opioid crisis obviously affects not only Roanoke, Virginia, but a lot of other places as well. So it's very important, that aspect. And you guys, being the ones who deal with the patients on the regular, your safety is definitely a top priority too. So that needs to also be thought about. So the way I want to implement change is through the change theory. I kind of have a quick blurb of it right over here. So basically, driving forces plus restraining forces in some capacity for each one will drive change, whether it's positive or negative. You just kind of have to work with both of them to get the change that you want. So the first stage is the unfreezing stage. It's a lot of implementation. No. It's a lot of stakeholder communication and research. So I did that by just talking with you guys, being on the unit. I did that also by the surveys that I gave you guys that you guys were so great to fill out for me. And then just kind of looking at my own literature in general. So that's kind of how I did that. And so some of the literature that I found, it was very interesting. As we know, we're in an opioid crisis. What I did not realize is that Virginia is home to 8 of the top 5% most vulnerable counties in all of the nation for drug abuse. And since 2000, drug-related deaths for opioids have shot up 200%. I knew it was a problem, and I've been affected by it personally, but I did not realize to quite the extent that it was. And heroin overdoses have increased from 2014 to 2015, 89%. So there's a big increase. There's definitely a need for a program like this. So it's definitely great that it's been implemented. So the Pathway program doesn't focus on just drug abuse. It's like a drug, psych, medical kind of thing together. And I also found very interesting that people suffering from mental health are no more likely than you or I to commit crimes. But when you combine their mental health and drug abuse together, that's when the increased agitation and violence and crime rate starts to go up. And that's a lot of what we deal with. I've actually never encountered a Pathway patient that doesn't also have some underlying mental health issue. So that's something that really needs to be addressed. And patients like the ones that we have, the ones with mental illness and substance abuse, are 4 to 5 times more likely to leave AMA than a regular patient, which is something we deal with all the time, as you all know. So programs like this, putting them on Suboxone, getting them all these kinds of things will really give them the opportunity to flourish, to recover, but it definitely requires them to want to recover as well. There are different risks to floor staff. Obviously, workplace violence is the top issue that you guys definitely have to deal with. I haven't seen any physical violence, but we definitely deal with verbal abuse on every level, every day. They always are yelling at us for pain meds or anything that it might be, and it's frustrating to us. But it's a symptom of the problem. It's not always who they are as a person. It's a symptom of the problem. So violence goes up, and then because we have to spend so much time dealing with them, sometimes we don't get to deal with the other like med-surg general acuity patients that we go to. So sometimes like our job performance is decreased and burnout can be increased and just emotional distress overall. So those are things that we have to look out for. There are ways to manage it. The best way to manage anything like this is just to be proactive. You don't want to have to treat the problem. You want to not let it get to the point where it is a problem. So there are different things that you can do to be proactive. You can do formal training. You can do additional education. A lot of people have talked about wanting security up here, so a security officer present is definitely something to think about too. But you will never be more successful than when you're proactive about it. So that's kind of where it comes into where I was surveying you guys. And I got a lot of responses, and I think 14 surveys is how many I got back. And I was kind of surprised to see the mix of positive and negative feelings on the program. But a lot of the positive feelings had to do with just like this is a great opportunity for people, and it's great for the patients, but the negative comments seem to be more related to how we feel about the program. Like, we're spending more time with them. We are like uncomfortable searching visitors, things like that. So it's not necessarily negative feedback that this is bad for the patients. We just have to figure a good way to bring the nurse and the patients, like, safety and priorities together to create a good program. So even though there was more negative feedback than I expected, I would still consider it constructive because it's all things that we can work from. There was nothing that anyone said that I thought, oh, there's no way that we can combat this. So that kind of brings me to all of the things that I thought we could do change. So it's actually like quite a few. They're all on these 3 pages, and it's kind of intimidating, but I think that they're all very good. So one of the things that I've always heard from you guys is that you want a locked unit. And when I first was talking with everyone, I was like, yeah, I'm totally pro 100% locked unit. But after doing some research, I'm kind of not really sure how I stand there. So in the literature, it was determined, and I know this isn't just quite a psych floor. There's med surge and stuff like that. So if it was locked down, it would definitely have to be pretty much just a pathway floor because regular med surge patients aren't going to be on lockdown. But not only that, but the security officer presence and just being there all the time, being on lockdown and all that kind of stuff, it creates a tension with the patients and it leads them to be more agitated, which can have a completely negative result than the one that you were hoping. Even though we were like, oh, this is for safety, it can end up having a reversal effect. So in kind of a compromise, I was thinking a one-way in, one-way out. And the way we can do that is if rooms 1 through 13 were designated for pathway because because the elevators are on this side and we can't really have control over those elevators. But if all the pathway patients, or at least you can.
Okay.
Yeah. She's just doing a presentation.
Yeah.
Oh no, I don't want to.
School.
Okay.
I mean, good for you.
It's going to be good. It's interesting. She did a
Great
project on the
job.
pathway program.
So if rooms 1 through 13 were pathway, especially the blue and the purple stones, we could really keep an eye on them better and not necessarily have it locked down. And then I know there's a door on that side, but that's some of the things in the handout. I looked up stuff that we could, we have the key security into the nutrition room and the staff lounge into this room. We could put one on that door on both sides, so it's a number entry. And I think the total for that, I don't know, I can't read my thing right now. But between that and putting magnets, because one of the things we do is we have the doors open in all the patients' room. So if we had a door stop system that was magnetic and connected to the fire systems, it wouldn't be a fire hazard and would also allow us to keep the visitors, the patient's door open when the visitors are in. So all that together, it's kind of a hefty amount. So if we did just 1 through 13, it's $3,700. But I think it would be very, very helpful to the added security because I was reading what you guys said about the contraband that people bring in as like drugs. You had like the disassembled AK-47 that someone was selling parts out of, like just yeah, all of like the different things that you guys have seen. And while a lot of the patients don't always pose a threat, it just takes the one to make the difference. So those are some of the physical changes that I would do. Oh, and then posting the pathway stones in each room. I know that we hand it to the patient, we're like, here, this is for your information. But sometimes the patients understand the rules, but visitors don't, and it's hard to like communicate that sometimes. But I think if they were posted in the wall and not just verbal, it would be like another reinforcement, like, hey, like this is what they have to do, things like that. Just another way to reinforce. So security officer presence, I surveyed you guys, and almost everyone wanted 24-hour security presence. And like I was saying earlier, the literature that I found showed that it just increased tension, and you shouldn't have weapons on a psych unit like they have their pistols and stuff that they carry. But one person who filled out my survey did offer up something that I hadn't even thought about, and that was just like hourly rounding. So I was thinking like day shift could have more or less frequent, because the pathway team's here, and I don't know, people just don't sneak around as much during the day is my thought, but maybe that's not accurate. And then on night they can do like 1 to 2 hours, but rounding instead of just a continual presence, because we don't want it to feel like jail. We want it, when we're the hope floor, we want it to be like happy and stuff like that. You look like you have a question, Samantha. No, you don't? Okay. So that would be my suggestion for the security officer thing, because what I'm really hearing from everyone is that they're just like uncomfortable and they aren't sure about their safety. And that's a huge thing. Like, you guys should feel safe. You shouldn't have to come to work and wonder if you're going to be safe today or not. You shouldn't have to do that. So for the pathway team, I'm not sure exactly who is on the pathway team and if there is floor staff on the pathway team. But if there's not, I think there should be at least one member of the pathway team from day shift and night shift, because you guys have a totally different perspective than anyone else does with the patients. I mean, we interact with them all the time. We go in every hour. We see them. They're the ones asking us for medicine, stuff like that. And your input is very valuable. And I don't know how much input you had into the program to begin with, but I think no matter what you had, whether it was complete input or no input from the beginning, from like here on out, your input is very important. Should be included. So for floor staff to be part of the pathway team, I think would be very beneficial. And then I think also pathway should have an open meeting each week with where any nurse can just come in, like discuss things, concerns, questions, just really like enhancing the communication, because that was something that everyone seemed to really note on their survey, was that there's just a lack of communication. And I think just making that more solid would really clarify a lot of things that you guys don't know the answer to. So program structure, everyone seems to not really know where each patient is at any point in time, or not really sure. I think having like the charge nurses give each other a report on all the patients. I think also for all the pathway patients, if they gave a report to each other and then they just like disseminated the information, like if Linda had a pathway patient, the charge nurse would go to Linda and be like, hey, they're on this stone. And it wouldn't be hard to like figure out, once all the rules were clear, like, okay, they're blue stone. I'm not confused on what they need to do. And if there were any other important updates that weren't just from that. So, but I definitely think it should be given to the charge nurse, because they're over the whole floor, and that would be a good way to get information out. I think there should be a designated pathway person 24 hours a day. A couple people wrote that they weren't sure who to go to for questions, which kind of surprised me that there's not a designated person, or if there is, it just hasn't been communicated. So I think there should be a designated person. And then I know that weekends are always a problem. We have someone coming in. Do they qualify? Do they not qualify? Do we put them on pathway? Do we not put them on pathway? That always seems to be a huge question. So I think having someone 24 hours a day on site would be super preferable, but at least available by phone to be on call to answer any questions that you guys have. And then the thing that no one seems to know the answer to is if a patient qualifies for pathway, but they're like, I don't want to sign this paper, I don't want to be in the program, what do we do? There needs to be like a concrete protocol for that. And I don't have the answer for what exactly that would be, but there definitely needs to be one created. I think the pathway team knows way more than I do and has the like resources to be able to figure out how to do that. And if it's still implementing some things for their safety, I think just whatever happens, it just needs to be set in stone so no one has any confusion. Because again, it's just really going back to the communication. And then addressing the initial thing that I thought this whole project was going to be about was visitors. Visitors just, they never really seem to understand the rules, and they think because they are not the patient that the rules don't apply to them, when in fact the patient is much more important than them, and they just don't ever. Sorry, I brought you.
Sorry.
You're fine. They don't really seem to understand that. So I think some policy changes definitely need to be in place. One of the things, I think there should be a list of approved visitors who are over 18. I mean, under 18 is usually their children, so I don't necessarily think that would be a problem. But there needs to be a list of approved visitors so like everyone knows who's coming in and out, because I've heard of people coming up looking for someone, and when they were like, oh, they're sleeping and they left, like we weren't sure, like, did they come to harm them? Did they not come to harm them? Oh, what if we show them their room and they, do you know what I'm saying? So I think a list of approved visitors would be good. But when I initially suggested that idea, someone mentioned like, oh, that would be great, but what if they put 10,000 people on their list? So I think it should be limited per their stone. So my suggestion was for the purple stone, you would have 3 approved visitors. For the blue, you would have 5, and for the green, it would be any amount. I mean, once you reach green, you're pretty much like doing good in the program and stuff like that. So you should be rewarded properly. But I definitely think having a list of visitors and a like finite amount would be good, because they don't need everyone running in and out of the room. It distracts them. Visitors are great for support, and they need a support system, but they came from a place and an environment that was detrimental to them. So to allow everyone that was detrimental into their lives back, even in the hospital, and bringing them drugs and all that kind of stuff is only going to make it worse. So, and each visitor, this one I'm not really like 100% grounded on, but I do think it would be an opportunity, is given a pass to the visitors when they sign in with a correlating color, so that when we walk in, we know they've signed in, we're not confused, and we know, like, it just in passing, we're like, oh, well, that visitor has a blue stone, so we know they're busy hours, like, different things like that. That way it's a good visual for everyone. And then I think the visiting hours should change. The purple stone, I think, would be fine staying the same, 11 to 1 and 4 to 8. But the blue stone, currently it doesn't have any upgrades. Like when you go from purple to blue, there's no change in visitor hours. There doesn't really seem to be a lot of change at all. So my suggestion would be 10 to 2 and 4 to 9. And I chose those hours because I didn't want to impede on group therapy during the week, because I know group is from 9 to 10. And like visitors are important, and I want to be able to provide support for them, but the whole point of the program is to be in group and stuff like that. So I didn't want to impede on that. And then greenstone, I just would keep the 7 a to 11 p. So there is, like I was going back, I'm going to backtrack a little bit. Those are my suggested changes. To implement these changes, it would require like constant communication from everyone, being open to everyone. I think like meetings would be important, updates. And then there's the cost of everything. And I put a handout somewhere, I don't know if you guys looked at it. But so if we did everything that I suggested with the magnetic door stops, the fixing the door and stuff like that, the total, if we did just the back half, the front half from 1 to 13, the total would be $3,705. And if we did all the rooms, it would be almost $5,400, which I know is kind of like a hefty amount, and my jaw dropped a little bit. But there are grants that can be applied for. I mean, people donate all the time. It's a huge hospital, so I definitely think it would be possible to do. But the whole reason that this was important to me, not because only I've been affected, but the theory of comfort is very important to me, and it's making them comfort in like all of their environments, in the physical, the environmental, sociocultural, and like the spiritual, all of that kind of stuff. And the pathway plays a part in each one of those environments in different ways, by doing the pain meds in the Suboxone, by doing like the layout and the structure of the unit, like changing it to where it would be more secure. That would help them be comfortable, because it would help us be comfortable, because when we're tense, we're only making them tense. And then just our general interaction with them also helps them in a lot of ways. But yeah, so that's pretty much everything I have. I know I've gone for way longer than I thought I was going to. But do you guys have any questions?
You did great.
Okay, awesome.
Can I get your, let me get your paper, I want to email that to you. If you'll email it.
Oh, yes. That didn't work. Okay.
Because I'd like to include
I'm
it,
very
and I will
sweaty.
make sure I include you as well.